Your circulatory system is this incredible, massive highway inside you. But just like any highway, it can run into some major traffic problems. We're talking about two big ones, clogs and clots. So in this explainer, we're going to break down exactly how these threads build up, and more importantly, explore the amazing medical science that helps us clear the way.
Okay, to get us started, just picture this. What if your arteries were like flexible drinking straws? Simple, right? For everything in your body to work, blood needs to zip through them no problem. But what happens when those straws start getting stiff and narrow and clogged? Well, that simple idea is really at the heart of our first big problem.
So here's what we're going to cover. We'll start with the whole clogged pipes issue of heart disease, get into the nitty-gritty of good versus bad cholesterol, and then look at how we can clear those arteries out. After that, we're going to pivot to the very delicate balancing act of blood clotting, see what happens when it goes haywire, and wrap it all up with how you can take charge of your circulatory health.
All right, first up, let's tackle the plumbing problem. This is all about a slow, kind of silent buildup that can lead to some really major issues down the road if we're not careful.
Now, the official fancy medical name for this is atherosclerotic cardiovascular disease, or ASCVD for short. And, this is one of the leading causes of death worldwide, so it's a big deal. The really crucial thing to get is that it's not just a simple blockage. The blood vessels themselves actually lose their flexibility, which just makes everything a whole lot worse.
So, how does this whole mess even happen? Well, it starts really small, with these little fatty streaks. But then those streaks grow into bigger plaques. Now this triggers an alarm in your body. Inflammation. Your body sends in white blood cells to fix the problem, but here's the crazy part. That actually makes the plaque bigger. It's like sending in a rescue crew that just adds to the traffic jam, narrowing the artery and choking off that vital blood flow.
To really understand plaque, you have to talk about its main ingredient, cholesterol. But, the real story isn't just about cholesterol itself. It's actually about how it gets chauffeured around our bodies.
See, fats can't just float around in our blood on their own, so they get carried by these particles called lipoproteins. And honestly, the best way to think of these is like a city bus system. The type of bus determines whether that cholesterol is being dropped off somewhere to cause trouble or being picked up and taken away for disposal.
And this brings us to the two main players in our story. First, you've got LDL, or low-density lipoprotein. This is the bad bus. It's the one that drops off cholesterol in your arteries, building up all that nasty plaque. But then you have HDL, high-density lipoprotein. This is the good bus. It's like the city's cleanup crew, cruising around, picking up extra cholesterol, and hauling it back to the liver to be thrown out. Okay, so if we've got way too many of those bad buses causing these huge traffic jams in our arteries, how in the world do we clear the roads? Well, this is where modern medicine really steps in.
When it comes to fighting back, medicine basically has a two-pronged attack. The first strategy is to go straight to the source and tell the body's cholesterol factory, hey, slow down production. The second strategy is to help the body get rid of the cholesterol that's already floating around. Now, you've probably heard of the superstars here, statins. They are masters of that first strategy. What they do is they block a very specific enzyme in the liver that's kind of like a master switch for making cholesterol. You block that switch, you stop the factory from churning out so much cholesterol. It's an incredibly direct and effective approach.
But, as with any powerful drug, there can be powerful side effects. Now, it's rare, but a really serious risk with statins is a condition called rhabdomyolysis. This is when your muscle cells get damaged and basically break down, releasing all their contents into your blood. And that stuff can be really toxic to your organs, especially your kidneys.
This quote from the source material, wow, it just paints such a vivid picture, doesn't it? It perfectly captures why this is so dangerous. It's all that spilled material from the broken water balloon that can poison the organs, which is why it's a true medical emergency. So another class of drugs takes that second approach we talked about, removal. These are called bile acid sequestrants, and they work down in your gut. They literally grab onto bile acids, which are made from cholesterol, and stop your body from reabsorbing them. So what happens? Your liver realizes it needs to make more bile. And to do that, it has to pull more of that bad LDL cholesterol right out of your bloodstream. Pretty clever.
All right, let's switch gears. We're moving from clogs to clots. Now, your body's ability to stop you from bleeding, it's a legitimate life-saving superpower, but it's a system that has to be kept in perfect, delicate balance.
So think about a leaky pipe. What's the body's first response? Squeeze the pipe. The blood vessel constricts to slow down the flow. Then, it sends in these sticky little helpers called platelets to form a quick, temporary plug. But that's not enough. Finally, it launches this incredibly complex process called the coagulation cascade to build a tough, super durable patch made of something called fibrin. And this whole cascade, it's just like a perfectly set up line of dominoes. An injury knocks over that first one, which then triggers the next, and so on. There are actually two different starting paths for these dominoes, but they eventually merge into one final pathway. And that very last domino to fall, that's the creation of that strong fibrin mesh that seals the deal.
But here's the question. What happens if some of those dominoes are missing? Or what if the dominoes just start falling for no reason at all? That's when this incredible, life-saving system can actually become a huge danger.
The system can basically fail in two completely opposite ways. On one side, you have too little clotting. Think of conditions like hemophilia. You're literally missing a clotting factor, one of the dominoes, so the chain reaction breaks down and the bleeding doesn't stop. On the flip side, you can have way too much clotting, where your blood gets, for lack of a better word, too sticky and starts forming dangerous blockages all on its own.
And these conditions, the ones with all the excessive clotting, they're called thromboembolic disorders. The clots they produce can literally choke off blood flow, starving your tissues of the oxygen they absolutely need to survive.
So yeah, the simplest way to think about it is that this sticky blood creates spontaneous traffic jams inside your circulatory system. And just like a real traffic jam on the highway, these clots can bring everything to a grinding and sometimes fatal halt. Whew! Okay, we've seen the two big problems, clogs and clots. So how do we actually manage all of this? This is where the partnership between you and your healthcare team becomes absolutely essential.
Look, managing this is truly a team sport. Your role is all about lifestyle, the things you can control, like diet and exercise, and crucially, sticking to your medication plan. Your doctor's role? They're your coach. They're monitoring your labs, tracking your progress, and educating you on how your medicines work and what to watch out for. The shared goal, for both of you, is to work together to keep your system running as smoothly as possible.
We've covered a lot today, right? From the body's plumbing that can get all clogged up to the emergency repair crew that can sometimes get a little overzealous. The big takeaway is that both of these systems need balance. So as we finish up, I want you to think about this. Now that you know how it all works, what's one small change, just one little thing, that you can make today to help keep your body's highways clear and its repair crew in perfect working order?